welcome everybody. We thank you for signing in today for this Assisi sponsored webinar. Today's presentation is going to be on feline urinary tract disease, helping cats to go with the flow. It's presented by Kara M. Burns. Kara is a licensed veterinary technician with a master's degree in psychology and a master's degree in counseling psychology. Ms. Burns is the founder and past president of the Academy of Veterinary Nutrition Technicians and has attained her VTS in nutrition. She teaches nutrition courses around the world on the VIN Veterinary Support Personnel Network. She's the director of veterinary nursing for the North American veterinary community and is the editor-in-chief of today's veterinary nurse. She was named the North American Veterinary Conference Technician Speaker in 2013 and in 2016. And she was granted an honorary VTS in internal medicine in 2011 and an honorary VTS in dentistry in 2012. So without further ado, please join me as we welcome Kara Burns today.
All right. Thank you so much for that introduction. And thank you everyone for being here today on Wednesday afternoon, or at least where I am. So it does mean a great deal to me that you would take your time and spend it here talking about feline, and we're actually going to talk about lower urinary tract disease. And first, I would like to thank Assisi Animal Health for putting on these webbies. It's amazing that they are providing free education to the profession and to pet owners. It's amazing to me that they continue to do this, for the last couple of years at least, because it's so important that we as veterinary healthcare team members work closely with you, as you are also a team member as a pet owner. So I love to do these because then we can talk. You can ask questions. You can see where or hopefully understand where we're coming from a little bit more, and we all learn. And we all learn together. So thank you so much to Assisi Animal Health for having these and for having me. I truly appreciate it. So as I said, we're going to be talking about feline lower urinary tract disease. Upper urinary tract disease is such a thing as well. There are disease conditions that we know are in the kidneys and in some of the tubules coming off of the kidneys. But we're going to focus on what we as healthcare team members and pet owners see much more often, and that is lower urinary tract disease in our cats. And with that, we experience our cats eliminating inappropriately. And really, that's one of the main reasons that we are bringing our cats to veterinary hospitals. Unfortunately, oftentimes, it's also a reason why we're relinquishing cats to shelters. Lower urinary tract disease is a very tough, long-term disease that can get very frustrating for you as the pet owner, and for the cat themselves. So I want to talk a little bit more about, what is it that we're seeing and how can we help our cats overcome this? And we could go into great detail. I know we don't have a lot of time, but we're going to kick it off today. And maybe we can do some follow-up presentations at a later date. But we know that feline lower urinary tract disease, in addition to being a common reason for taking our cats to the veterinarian, we also know that it affects the quality of life of cats and their owners. And really, it can have a huge impact on that human-animal bond, right? We love our cats. I love mine. We have 3, and they are such joyful creatures, right? I love my cats. I love to hear the purring. I love to see their antics, the whole 9 yards. And I'm sure that you guys are the same. So we don't want to end up with a disease in our cats that affects that human-animal bond. So then we should look at, okay, so what are some of the causes of lower urinary tract disease? Sometimes you'll also hear it called lower urinary tract syndrome, okay? So really, if we're talking causes, there are a number of different causes, and maybe, you know, you have run into some of these with your own cats. Hopefully you haven't, but I'm assuming if you're here, maybe you have in the past. So uroliths, which we also know as crystals, or you may have heard them called stones, right? Struvite stones, calcium oxalate stones. About 20% of the time that we have a lower urinary tract disease, that's going to be those uroliths or those crystals. 15% of the time, it's going to be plugs, where the urinary tract, it actually gets plugged up, just as it says. And it's usually an entire matrix of struvite, again, that builds and builds and blocks that cat. Miscellaneous, so cancers, sometimes the anatomy, how it forms, is just, you know, not quite right. So those can also lead to lower urinary tract disease. And what I was leaving to last, 60% of the time, we don't know the cause of lower urinary tract disease. What we call that is feline idiopathic cystitis. Idiopathic means we're not really sure what the cause is. And so we have, obviously, if I'm here, we're going to talk a little bit about nutrition. So we have nutritional management opportunities with these. And there's a great multimodal approach, if you will, to helping with all of these different causes of the disease of lower urinary tract disease. So I would ask you, you know, if you've had a cat with lower urinary tract disease, what has your healthcare team recommended? Probably you've had some pain medications, right, for your pet, because of feline lower urinary tract disease is extremely painful. There's a huge inflammatory component as well. Environmental enrichment, we're going to talk a little bit more about that one. Increased water intake, canned food, you've probably heard of some of these, right? NSAIDs, there's not a lot of NSAIDs out there for cats, so we have to be very careful with that one. And omega-3 fatty acids, so you can see where nutrition and certain nutrients are coming into play. So here is, you've probably heard it called feel away, but there's pheromones, the food we talked about. We're going to talk more about environmental enrichment, and actually there's also, you know, specific nutrients in cranberries that can help. But let's just keep moving on here. What is our goal, right? What do you want to help your cat? What do you think will help your cat with therapy for FIC or lower urinary tract disease as a whole? Well, I think overall, we are trying to decrease the number of painful days. That's you as a pet owner and me as a veterinary nurse, a veterinary technician, and the veterinarian, right? One goal, you know, we want to make the cat more comfortable, especially during a fluted episode. And as I mentioned, we have very few effective oral analgesics for cats. NSAIDs don't really help with the pain in people with interstitial cystitis, which is a disease similar to FIC in cats. So we're going to focus a little bit more on FIC because of that one is a little more elusive, if you will. So bottom line is we want to decrease the number of painful days. And so how is nutrition going to help? Well, you know, I love to talk about nutrition, and if we are trying to help manage lower urinary tract disease in cats, then we want to control those building blocks of uroliths and plugs that I mentioned earlier. So we want to control levels of magnesium and calcium and phosphorus and oxalate, because that's going to reduce those building blocks. We also want to add citrate. And I'm not telling you this so you can go out and you know, look for these things. There are diets, more than one, that have these nutritional profiles and that have these nutrients in them to help you manage your cat and their diagnosis of lower urinary tract disease. Because with citrate, again, what we're trying to do is inhibit those crystals and those stones. And then vitamin B6 is going to help decrease oxalate formation and excretion. So again, what we're talking about here are limiting and inhibiting those building blocks for uroliths and crystals and what we know better as stones. An antioxidant bundle. You know, we've talked about antioxidants in the past as well as in human nutrition, right? But we have to remember and continue thinking antioxidants in both human and veterinary foods. Vitamin E and beta carotene are going to help counteract oxidative stress. So that's the stress our cells run into day after day, hour after hour. And it's going to help generate an environment, again, that those crystals or those stones don't find favorable. And we definitely don't want to enable, right, those uroliths, those stones to develop. And then omega-3 fatty acids, because as I mentioned, this is a painful process and it's an inflammatory process. So omega-3 fatty acids are going to help break that inflammatory cycle. As we move forward, I'm also going to talk about a couple of nutrients that will help manage the stress that is a big part of lower urinary tract disease, especially with feline idiopathic cystitis. Before we get there, I mentioned environmental enrichment a little bit earlier. How does that help? Cats become very stressed very easily, right? Because they're not used to different environments. They don't like change. They don't like loud noises, etc. So I want us to think about, you know, they used to be outside animals, right? A lot of people have brought them to be inside only. Not everyone, but you know, oftentimes cats are inside more often. So we have to make their environment what they think it should be. So we want to provide opportunities for play and those enjoyable activities. So you see here, scratching posts, right? Toys, places to hide or rest, kitty condos. And we really need to think about their food and water dishes as well as their litter boxes. Where are those? How clean? How often are we cleaning them? So first, let me show you, you know, some of the kitty condos and those places to hide, right? So in the middle here and the lower left, we have some what I call cat condos. There's a ton of room in this one. They can sleep here, right here. They can hide. They can go behind and hide. Same is true here. Okay. These also double as scratching posts, so they're not using your furniture. We also have interactive toys, right? This is a mouse that kind of moves along. It's a play mouse that they can play with, obviously. And then there's toys in here, which also helps with cognitive stimulation, right? Because we've taken them from the outside where they were hunting, where they were playing and had places to hide, and we brought them inside. It's not a bad thing at all. we're trying to provide, a safe haven for them, but we also have to provide some enrichment for them as well, especially to bring down some of that stress that exacerbates lower urinary tract disease. And then we have to think about the litter box. And there are veterinary behaviorists who do a lot of research on litter boxes, what should go in litter boxes, how high litter boxes should be, etc. So this litter box that you see here might be okay for an only cat, but if you have a skittish cat that has other cats or maybe even dogs in the house, then this isn't always the best, because of the other cats will hide right on the side. And as this guy comes out, boing, they're going to pounce on them, right? So we have to think about that. We want to provide, again, safe havens. And is there a proper amount of litter boxes for a household? Well, veterinary behaviorists would say yes. They would say that there should be a litter box for every cat in the house plus one more. So if I have 3 cats, which I do, I should have 4 litter boxes, which I do. And, if I were to be talking to you about the proper litter box recommendation for cats in general, but especially for cats with lower urinary tract disease, I would want you to know that it should be 1.5 times the length of the cat. To think about, if you have an older cat, then we should have lower sides so they can actually get in, because oftentimes, especially with those jumbo litter boxes, and I've had them before myself, the sides are very high, and it's hard for the older cats, especially older cats with osteoarthritis, to get in those litter boxes, and then they end up going next to or in another area. And again, as I mentioned here, they should be located where the cat can escape. It is absolutely true that most cats prefer litter that is clumping and unscented. The scent is put in there for us as humans. Cats, imagine being that close to the scent and digging in it and having to smell that. Cats don't like that. And then we should be, cleaning up these litter boxes, scooping them every day, yes, but definitely also cleaning them at least once a week. So I like to present research that supports what we're talking about. And this study did look at multimodal environmental modification in the management of cats with FIC. And, by providing that environmental enrichment, it was found to reduce signs of lower urinary tract disease, fearfulness in the cat, and nervousness. And just as an aside, I want you to know that the Indoor Pet Initiative has resources for you as pet owners on their website for cats, yes, and if you have dogs as well, for dogs. And they started to also go into other species. So this will help with our understanding and with ideas as to how to interact with or develop environmental enrichment tools, resources for our cats in our home. Because fewer painful episodes means less of the cat being in the litter box, right? And we get back to that human-animal bond, which we talked about at the very beginning. So yes, we know that this cat is very stressed. They showing the fight, flight, or freeze response. But do we know if this cat is stressed? And yeah, this guy is also most likely suffering from the effects of chronic stress, and which puts both of these cats at higher risk for fluted, especially FIC. And then oftentimes it's the signs of the subtle hiding cats that may go unnoticed by us as pet parents, right? So just trying to bring this to your awareness. So what are some of the risk factors consistent with stress? Well, nervous and fearful. Someone comes over and rings the doorbell, right? Then comes in. Most cats, not all, but most cats don't like that behavior at all. And another huge one is moving. Okay, now that's stressful for everybody. Humans, dogs, cats, birds, you name it, right? But it's especially stressful for our cats, even if within your house you are moving furniture. Cats get used to a routine. They get used to everything being in its place, and they can become very anxious and stressed when we move that. Again, that's a risk for lower urinary tract disease. So if we were to look at what are some of the common anxiety triggers in cats, well, we know people, right? They're used to their own people. And some cats are so friendly that, anyone could come in and they'd be like, oh, this is awesome. But the majority of cats don't want to interact with new people coming in. That's an anxiety trigger for them. Sounds, loud sounds, similar to dogs and noise phobias. Cats, don't like sudden noises. They don't, even loud talking or music, thunderstorms, the doorbell or the phone ringing. Cats hate that sound, those sounds. And then other animals. We can have a household full of animals, absolutely. But we can also have other animals in the house which are causing stress and anxiety in our cats. So I know you were thinking, how does stress contribute to feline lower urinary tract disease? Well, good question. And so what happens is, okay, there's some environmental stressor, which we just talked about, right? One of those, or maybe multiple ones of those. And that's going to activate the stress response system within the brain of the cat, which then results in enhanced sympathetic activity, which increases outflow to the bladder. And then what we're seeing is stress inflammation, okay? So that stress inflammation is causing sensitivity in the bladder. And then the nervous system, right, our spinal cord, is transferring that pain back to the brain, which then causes further stress. So I think you can see here that this is a cycle, right? We don't have to understand, all the nitty gritty, but you see that stress response is activated. It affects lots of different parts of the body, but most definitely the urinary bladder. We get inflammation, and then the nervous system sends that inflammation and pain back up to the brain. So we can honestly say that stress affects the bladder and the brain. So what are we going to do? Well, here we have our chronic stress leading to an abnormal stress response, right? Which leads to inflammation of the bladder, which leads to chronic pain, which becomes a vicious cycle. And we see this all the time in feline lower urinary tract disease. And we end up with a cat that isn't feeling very well. So what we need to do is come up with, and we being the veterinary healthcare team in conjunction with you as the pet owner, we need to be working together to help manage that stress. There are behavioral therapies that can be instituted. Obviously, my particular favorite is nutritional management. We've talked already about some of that, and we're going to talk a little bit more. And then pain management. We're going to talk a little bit about pain management. And by having this cycle, this multimodal approach, then we're going to see the cat becoming or going back to being part of the family, and that human-animal bond is strengthening. So I mentioned a couple of nutrients that can help with stress in cats. And the first one comes from an ingredient derived from milk, from skim milk. Milk contains a natural peptide or protein called alpha casozepine, okay, or alpha S1 casein. You don't need to know any of that. What is happening here is it is being synthesized down to hydrolyzed casein, which is a milk protein hydrolysate, which we know to be alpha casozepine. So think about the old tales of, you know, my mother-in-law still does it to this day. She drinks warm milk before going to bed, right? Because it helps her to unwind and sleep. That's what this is in theory, right? So we're getting the alpha casozepine from milk, and it's been synthesized down, so, you know, we're not getting the allergic or the intolerance to milk. We're getting that natural peptide or protein. And it is helping with mood and anxiety. This is why I get excited about nutrition for our animals, right? And we've seen this decrease anxiety in a number of species. Rats, okay, a couple of different studies have been done with alpha casozepine and decrease in anxiety in rats. Decreased stress response in humans and in ponies. It actually improved training and decreased stress. So, okay, that's all well and good. We're talking about rats and humans and horses. What about cats? Well, what was shown in this study was, again, that this alpha casozepine was related to decreased fearfulness and increased contact with people. One of those main, you know, stressors, anxiety producers that we talked about. So then we also have heard of tryptophan, right? Many of us have heard of tryptophan, especially with the holiday that's coming up, right? This tryptophan in turkey, right? I think it's more the amount that we eat than the actual tryptophan itself that makes us so tired after our Thanksgiving dinner. But this is another nutrient that has anti-anxiety benefits. It's an essential amino acid found in many animal and vegetable proteins, and it's converted to hydroxytryptophan and then to serotonin. And I know many of you have heard of serotonin when we're talking about mood altering medications. And so again, it was looked at in humans, in dogs, a couple of different studies in dogs. And we also, I didn't have anything to do with it, the profession, some very smart scientists also looked at how it affects cats. And by adding Ltryptophan to their diet, cats exhibited less anxiety and stress-related behaviors with Ltryptophan in their diet. So this is, you know, a couple of reasons why I get so excited about nutrition. Now, that's going to help with pain and anxiety, but we also know our veterinarians are going to talk to us about analgesia and pain medications, right? But what I also want to mention is, in addition to pain medications, because we're trying to manage this pain that the cat is suffering from with feline lower urinary tract disease. So a great tool is the Assisi Loop. And again, as you guys know, it offers targeted pulse electromagnetic field therapy in portable, easy to use devices. And it's delivering a signal tuned specifically to minimize pain and accelerate healing. And you can see this guy here, right? We're trying to get back towards the bladder to help with the pain and inflammation of this cat's bladder. It stimulates, the Assisi Loop helps to stimulate the body's own natural anti-inflammatory process while speeding the healing of soft tissues, the bladder being one of them. And so we know the benefits: reduce pain, right? Reduce swelling. And that's what we've been talking about, pain and inflammation. It's compatible with other treatments, so nutrition, analgesics, and can actually help to reduce the amount of pain medication, or take it away completely. So as I mentioned, we're just touching on some of the issues associated with feline lower urinary tract disease, and we're really helping, trying to help cats to overcome, or at least we're helping to manage lower urinary tract disease, especially feline idiopathic cystitis, because we want to stop this behavior where they're always in the litter box, or maybe even going outside the litter box, which sometimes results in them being relinquished to shelters. Instead, what we want is fewer painful days, and we want to strengthen that human and cat bond, right? Our goal is fewer painful days for the cat, obviously, for the family, and for the healthcare team. And the key to breaking this painful cycle of stress is this multimodal approach, which we've talked about. And again, we don't have a lot of time to go into all of these in great detail, but there are tools out there. So if you do have a cat with lower urinary tract disease, hopefully now when you go in, we can talk to our veterinary teams and say, hey, I know that stress is a component of that. Let's talk about that. What are some of the behavioral therapies? Especially if those cats have developed litter box aversions, right? Nutritional management. We talked about just some nutrients for feline lower urinary tract disease overall, and for feline idiopathic cystitis, right? Which is the stress component, and pain management. So especially during those acute episodes. So we have analgesics, yes, that our veterinarians can prescribe, but we also have the Assisi Loop, which has been shown to phenomenally decrease the amount of pain and inflammation in our lower urinary tract disease cats. So I want to thank you all. Look at these two, huh? They're not too stressed. I want to thank you all for being here and see if there's